The number of people hospitalized due to COVID-19 in the country is likely to increase as more provinces enter the third wave, putting a strain on bed capacity. Research scientists say the current hospitalization rate is increasing, with Gauteng at 30%. Week on week, Gauteng, which accounts for over 50% of the country's COVID-19 infection rate, has increased bed capacity at its hospitals despite the closure of Johannesburg's Maxeke Hospital. Now, to discuss this, we are joined by Gauteng Health Department's Acting Deputy Director General for Hospital Services, Dr. Freddy Kgongwana, and we are also joined by Professor Koleka Mlisana, co-chair of the Ministerial Advisory Committee on COVID-19. Thank you so much to you both for joining me this afternoon. Prof, maybe let me start with you because I know you are pressed with time. Give us a global, a national picture in terms of where we are in terms of these COVID-19 numbers. A lot of people haven't wanted, or should I say experts, have not declared that the country as a whole is currently experiencing the third wave. We know that Gauteng is in the third wave, and we know that 3 other provinces are. Are we in the third wave as South Africa? What are the numbers looking like?
Okay, good afternoon, Unati, and good afternoon to my interviewee, Dr. Kgongwana, and good afternoon to all your viewers. Thank you for having me, in this discussion. Where are we insofar as the pandemic is concerned right now? Yes, we all are very concerned about the third wave. And as you correctly say, we know that Gauteng is in the third wave. So is Free State and Northwest. And actually, if we're looking at the numbers, all provinces now are showing increase in cases. So it's really just a matter of time unless the interventions that are required, they are successful. But really, as we look at things, all the provinces are showing increasing numbers. I know you just showed us the numbers that, were currently recorded 2 days ago, but I was just looking at numbers today, which would be last 24 hours. And it is actually sad to say that when those numbers come out later tonight, we will see that the number of cases has actually doubled in that. For yesterday, which is 24 hours ago, we had more than 8,800 cases. In fact, to be exact, 8,881 cases. And in fact, we're sitting at 17% increase. And of those, a significant number, in fact, 54% is coming from the Gauteng province. And that's why we are very concerned about Gauteng, because it actually has jumped from the 2,452 that it was the day before to 5,000, more than 5,000 cases. So it really is a serious concern. And we do know that really at the end of the day, we can put all the measures that need to be taken, but it's still gonna take each and every South African, specifically those that are in the Gauteng province, to ensure that they adhere to the non-pharmaceutical interventions. Whilst, yes, we will do other, whatever else that it takes for the department, for instance, to ensure that the hospitals are equipped. And I'm sure my colleague will actually respond to that as to how the province is preparing for that. Our concern, obviously, is that as the numbers increase, then within a matter of a few days, we then see this on increasing admission rates. And what we don't really want to see is to see our health system caving in. So we really just need to appeal to the public that they really need to make sure that we don't spread this more than where we are at the moment.
Dr. Kgongwana, perhaps let me bring you in now, just listening to what the professor is saying and taking into considerance what I had heard from some of the health experts earlier on is that we are in the eye of the storm of COVID-19, particularly Gauteng. What is the status of hospitals in the province at the moment? I mean, we know that some of our hospitals are not in very good shape. We've spoken about the Maxeke Hospital where there are, issues of water shortages, etc. How are we looking like in the province at the moment?
Thank you. I've just experienced load shedding. Sorry for that, but the light is back now. Okay. let's get the Charlotte Maxeke story clear. Charlotte Maxeke was disabled by the fire that took place on the 16th of April. And to date, we've been working on getting Charlotte Maxeke back, which is one of our bigger central hospitals, which are 4 in the province. And we need Charlotte Maxeke back as soon as yesterday. But there's been collaboration between the DID, the City of Johannesburg, and ourselves to make sure that Charlotte comes back. But most of the patients that we're accessing health at Charlotte Maxeke are in the 17 hospitals in the province. And that has meant a reduction in the bed capacity that we had prepared to deal with the third wave, because we were anticipating the third wave in the winter of 2021. If you look at the trends, winter has a tendency of giving you high levels of COVID-19 infections. So we currently have close to 2,700 beds that are repurposed in the facilities, all the facilities in the province to deal with COVID-19. We've got a dashboard which is live on a daily basis, electronically, that gives us where the pressures are, that tells us how many patients are occupied, occupying the beds in the hospitals, and we're able to, in real time, be able to effect interventions. That dashboard is accessed by ourselves in head office and all the CEOs and clinical managers in the province so that we can engage. We are aware that one of the key pressures for us is the PUIs, those individuals that still have to be investigated if they are COVID positive or not. And as a result, the alternative building technologies that were built, these facilities, we got one in Bara with a capacity of 500 beds. We got one in Jubilee with a capacity of 300 beds. We've got one in Brongospruit with a capacity of 150 beds. We've got Anglo Ashanti with a capacity of 175 beds. Those are the ABTs also to mitigate for the loss of the Nasrec. Remember, Nasrec had 1,000 functional beds, and we had to mitigate. But if you can remember, even the second wave at the peak, we didn't go above 500 admissions in Nasrec, even though we had a capacity of 1,000. So there's also lessons learned from the first and second wave, that what we have at the moment, because we didn't even go above 3,000 of occupation of those functional beds that were designated for COVID in our hospitals. But remember, we still have to do the non-COVID attention of our population, your maternity, your mental health, and so on. So it's a balance, and it's a risk-adjusted and a demand, needs-based strategy that we utilized in the second wave.
Dr. Kgongwana, I want to go into details in terms of just some of the regions that you find problematic in the province. But let me bring Professor Mlisana here before she leaves us, because she does have to rush. Prof, we've been seeing reports of the different strains that are currently at play in several countries. But I want to actually probably talk about the variant that is in one country specifically. We are hearing that in Vietnam, they are seeing strains that first appeared in the UK and another one that is currently in India, both variants at the same time in one country. Is something like that likely to happen in South Africa?
Okay, so when we look at the variants, currently at global level, we've got 4 variants of concern. The one that was first identified in UK, we are now calling that Alpha. So the Alpha variant. Then the one that was first identified here in our country is the Beta variant. The one that was first identified in Brazil is the Delta variant, the Gamma variant. And the one that was identified in India is the Delta. So basically, the UK, if you look at the Alpha and the Delta, which are the 2 variants you're talking about, those are the variants that actually there's a lot more information that is coming out. What we know is that the Alpha, the Beta, and the Delta, they actually increase transmissibility. So they are more infectious in that when they come in, we see a lot more infections. What is also coming out is if you then compare the Alpha and the Beta and the Delta from India, the transmissibility looks like the one that actually originated or was first identified in India, which is the Delta, is more infectious than the Alpha. And we see this because it now has sort of overtaken most infections in the UK. What about our country? At the moment, we are sitting with more than 95% of infections caused by the Beta variant, which was the variant first identified in our country. And we have been monitoring these other two variants of concern, and we know that the Alpha variant has actually been detected in the country, but fortunately, we seem to have contained it in that, you know, as we follow through all these infections, it has not overtaken us in any way. And the same thing with the Delta variant, which was first identified in India, in that it really seemed to have been contained within the members, that the crew that came in with it was docked in Durban. So really, to come back to your question then, we still have got the majority of infections, more than 95%, are caused by the Beta variant, and we have not seen a lot of the other variants, the Alpha as well as the Delta. It becomes important for us to make sure that we keep those variants at bay. So we want to continue with the genomic analysis surveillance to keep track and see whether there are no other new variants that are coming in. So it's going to be important for us to monitor the situation. But for now, we really are still having the majority of the variant that was first identified here, which is the Beta variant.
Professor Mlisana, thank you so much for your time and for your analysis. This is where I'm going to let you go because you have other pressing matters to attend to. Thank you so much, Prof. Doc, please stay with me. That was Professor Koleka Mlisana, co-chair of the Ministerial Advisory Committee on COVID-19. Dr. Kgongwana, obviously, the professor bringing in some very interesting, statistics as it relates to those various variants that we are hearing, taking a fold in the global space, particularly the Alpha and the Delta variants that are found in the UK and India, respectively. But it is good to know that those are at bay at the moment and they are not in South Africa or have not been traced in South Africa. But just going back to the region, as it were, Gauteng province to be specific, you have mentioned that you seemingly having things under control at this point, but we are on the third wave in Gauteng. Talk to me about the various regions in the province that are most problematic for you.
Remember, we've got 5 districts in Gauteng. Is the Tshwane, City of Johannesburg District, Ekurhuleni, Sedibeng, and the West Rand. So the 2 major districts that have pressure is first City of Joburg, followed by Tshwane, and the third is Ekurhuleni, and then followed by the West Rand, and lastly is Sedibeng. We know that when we were moving towards the resurgence, Mfuleni, which is a sub-district in Sedibeng, was the first to cross the threshold for the third wave. But we have more pressure in City of Joburg and more pressure in City of Tshwane. Probably this metropoli, because they are bigger and have more activities, including Ekurhuleni. There's a chance that there's the reason why we're having more pressure. And of course, Maxeke was a curveball that really created a lot of challenges for us. But we needed to mitigate that by having the patients sent to the different hospitals in the 17 hospitals in the department. Yes, the availability of the ABTs. ABT stands for Alternative Building Technology. These were scheduled where infrastructure that was deployed and constructed from last year and recently been delivered. So that gives us a source of relief that we're able to have beds that we can functionalize. They've got health technology. They've got oxygen available. And of course, when I speak about oxygen, we have bi-weekly meetings with AFROX for the security of oxygen in the province. Yes, the recent water issues with Rahima and Helen Joseph have also highlighted that it's important for us to also monitor availability of water, because as you know, COVID-19 needs you to wash your hands, it needs you to clean. So water is a very important commodity for us in the healthcare sector, of course, for the population in Gauteng. So we are monitoring that daily, twice a week in the NEF center, but daily we are monitoring our dashboard. We are getting reports, and we will have contingency meetings when it's necessary for us to make sure that we do particular interventions in the various hospitals that have more pressure. We are monitoring that on a daily basis. We're not going to drop the ball. We're not going to be complacent, because we really want to defeat the COVID-19 pandemic, but also to save lives. in our communities in Gauteng.
Now, having heard what Professor Mlisana has just said about those numbers in Gauteng, I mean, she used the words that she's very concerned about the numbers in Gauteng. She's very concerned about what is happening in Gauteng. And you've just mentioned some of your capacity issues in terms of those hospitals that you would like to free up as soon as possible. I spoke to the South African Medical Association earlier in the week, and they've said that we are in the eye of the storm in terms of COVID-19, especially as it relates to Gauteng. Do you then think that it would be necessary to tighten restrictions around COVID-19, specifically as it speaks to this province and maybe some of the regions, as you've mentioned, which are most problematic for you?
I think we'd rather take the risk-adjusted approach and demand informed approach. As you're aware, the issues of economics have had a major impact also on the mental health of our communities. So we rather get advisory from the National Command Center and the Provincial Command Center. One, will not really push for tighter restrictions. Let them be informed by data, let them be informed by reality on the ground, because really we are sensitive to the economic impact of our communities. Remember, we have pressure on mental health, and we wouldn't want to exacerbate that by continuing to have hard economic pressures on our population. But of course, we encourage everybody to adhere to the non-pharmaceutical interventions. And for us to take COVID-19 seriously, it is a dangerous disease. It is very dangerous, and we have to be very, very careful, and we need to follow the advisories of our government, advisory of our experts, advisories of all those people that care, civil society, that let us take care. So for now, we are aware that we are not in a safe space, we're not in a comfort space, but we cannot afford to panic. We just need to be very, it's like a pilot going through turbulence. If you panic as a pilot, then you crash. So we cannot afford to crash this whole thing. We have our eye very closely on the ball, on the eye of the storm. And we're thankful also for the support from National Department of Health, from NGOs, and all the citizens of our country that are really concerned and caring that we should make sure that we support one another and defeat this what I call a terrorist called COVID-19, which doesn't play fair.
All right.
And one is to really salute our healthcare workers in the front line who are in the trenches to really battle this disease.
All right, thank you so much, Dr. Kgongwana, for that analysis and also for your time this afternoon. That was Dr. Freddy Kgongwana. We also were joined earlier by Professor Koleka Mlisana, Chair of the Ministerial Advisory Committee on COVID-19. They're saying do not panic, but the numbers are concerning. And yes, we are indeed in the eye of that COVID-19 storm, particularly in the provinces that are in the third wave, including Gauteng.